Hi, my name is Taylor Collins. I'm an MSOT student at Kaiser University, and here are my clinical reasoning questions. Question 1. The OT is completing a pre-discharge evaluation after the client's 3-month of outpatient OT following a hand injury. The individual has not been able to work for 3 months and is unable to perform the job requirements as a truck driver. What should the OT recommend at discharge? I picked C, work hardening. I picked work hardening because the question is in regards to his job and talking about how he is unable to perform his job. Another good option would be a home exercise program that he would be given, but at discharge, the best option would be C, work hardening. Question number 2, an OT is preparing to evaluate a toddler who has upper extremity orthopedic concerns and difficulty with self-feeding while childcare. How will the OT most likely obtain initial assessment data? My answer is C, observing the child during eating activities while he's at child care center. I picked C because even though it is a non-standardized assessment, you are still able to get all the information that you need to. The dynamometer is more in regards to like grip strength and pressure, while the measurement tool is an assessment of visual motor skills. It's talking about self-feeding, even though yes, it is visual motor. I picked. Question number 3, an OT working in a long-term care facility needs to evaluate long-term memory of a resident. Which is the best evaluating memory or personally experienced events? And then it states declarative memory. I picked B because it's asking how the individual spent the New Year's or holiday. Declarative memory talks about facts, events, or experiences. Asking a client the place, date, time is about orientation, and showing them something quickly is working memory. Question number 4, a person with a long history of Parkinson's disease is experiencing a considerable fatigue during the day. The best way to enable the individual to maintain the level of function is to teach them what? I thought the best answer would be C, pursed lip breathing. Working through the fatigue, you never want to have a client do that. You want to have them take rest breaks, prefer desired activities in a simplified manner to conserve energy is a good option, but it's not just preferred activities that they're having difficulty with, it's all activities. So I would pick C. Question number 5, an individual Guillain-Barré acute syndrome demonstrates poor to fair strength through upper extremities. Which is the most appropriate for the OT to use when planning treatment for the early stages? I chose gentle, non-resistant activities, which is A, because this is due to it being in the early stages. They have poor to fair strength throughout the upper extremities. You don't want your client to be too tired throughout the activities. You wouldn't choose fine motor or resistive exercises in those early stages. Number 6, following radiation therapy for breast cancer, an individual develops lymphedema in upper right extremity. She's experiencing functional deficits and is referred to OT. Treatment to reduce swelling would be to have her fitted for the compression garment. The compression garment can help manage and reduce the lymphedema by promoting drainage, while you don't want to be putting somebody in a hot pack or any heat. That's why I picked that one. You also don't want to be doing like the isometric exercises because that can promote strain on the muscles and increase the swelling. Change of dominance, you wouldn't do that. Number 7, the OT working with a woman with Alzheimer's who demonstrates mild to moderate decline, lives with her husband who works during the day, the OT should focus on interventions on what area. I picked B, kitchen safety. If the client's left at home, you need to be worried about her safety in all manners, whether it be sharp objects, using the stove. You want to reduce those fire hazards. Kitchen safety can also like having timers in the kitchen to eat, to take medication. Though people with Alzheimer's do have anger because they either don't know where they are at sometimes or they don't understand what's going on, that wouldn't be what you're working on for somebody that's left at home. She only has mild to moderate Alzheimer's, so you wouldn't have to work on the ability to chew and swallow yet. Number 8, OT treating restaurant worker with pain resulting from a cumulative trauma disorder. The OT suggests elastic taping to decrease pain in upper extremity while working, in addition to decrease pain. This taping may also decrease inflammation and edema. If you are taped correctly, it should be able to lift it up and increase circulation. It should not limit your range of motion. It should not cause muscle fatigue. It should not desensitize the upper extremity. Number 9, an OT work with the individual with ALS who develops sacral decubitus, has recently become too weak to turn himself in bed. What should the OT do next in regards to client caregiver instruction? We should do next is teach the caregiver how to position the client safely. Those living with ALS are going to be declining, so you wouldn't work on a strengthening program with them. You wouldn't do next providing an environmental control for the client's home. You may suggest that they begin a wheelchair education program, but that wouldn't be next. You want to educate the patient and their client and caretaker first. Number 10, the hospital-based OT is working on a discharge plan. Number 15, a 6-year-old auto mechanic with diabetes and impaired sensation in the residual lower limb has been referred to OT with prosthetic trainings following an above-the-knee amputation. The first item the OT practitioner should address. I pick skin inspection. You always want to inspect your client's skin if they have diabetes as well as impaired sensation, especially in the lower extremities, because they are susceptible for sores, which can lead to infections. Nail trimming, we don't really work on that. The client would go to a podiatrist because it is such an intricate thing. Retirement planning and returning to work, we're talking in regards to prosthetic training, so we wouldn't be working on that. Number 16, the OT is applying the PNF techniques for weight shifting during activity that requires an individual to use the right hand to remove groceries from the bag on the floor to the right. The most beneficial would be D, the upper cabinet in the left side. PNF is working on diagonal movements. So if you're working on the bottom right, then you're going to bring it to the upper left, because again, it's all about diagonal movements. So you're not going to go straight up like C is suggesting, or you're not going to just go halfway like the other ones are suggesting. 17, an individual diagnosed with COPD is participating in a pulmonary rehab program. Which will the OT most likely recommend? Again, it's going to be A, performing pursed lip breathing while doing activities. That's the best option. Those living with COPD get fatigued really easily, so you want to work on energy conservation techniques. The other one's taking a hot shower to reduce congestion. You don't want the steam to actually worsen the COPD. Using a long-handled sponge while showering, that is a good option, but again, we're working on, it's talking about COPD and the pulmonary issues, not about the client's inability to bathe or to reach something. 18, fabricating the resting hand splint, an orthotic device for an individual with extremely fragile skin. Which areas should the OT have to inspect the most? For signs of skin breakdown, it's going to be C, the ulnar styloid, distal head of the radius, and thumb MCP. These are the Bromine prominences that can rub against the splints. So you always want to be checking for redness. You want to be checking if there's any open sores or anything like that. You never want to get it to that point. So always checking those areas. What is the most, number 19, what is the most appropriate interventions for OT who plan on treating a person following a total knee replacement? That would be C, providing ADL and use of adaptive techniques for lower extremity dressing. I picked that one because it's the most appropriate. You're not going to be observing them in homemaking activities. You're not going to be doing strengthening activities in the lower extremities or upper extremities post knee replacement. And the last one, number 20, the administrator of a long-term care facility asks the OT who works there to help develop a job description. What would an OT description most likely contain? I picked D, the job title, the employer's expectations, productivity expectations, and how they will perform will be measured. Everything else is kind of more subjective, talking about personality characteristics, physical exertion requirements, evidence of relationship building. We're just focusing more on the prime OT job descriptions, and that's it. Okay, thank you.